Notice, the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual health professionals or patients. Thank you. Conversion disorder, now more commonly referred to within the framework of Functional Neurological Symptom Disorder, FND, is a complex condition characterized by neurological symptoms that are inconsistent with or cannot be fully explained by medical or neurological conditions. It involves the presentation of physical symptoms affecting voluntary motor or sensory functions, suggesting a neurological or medical condition. Yet these symptoms are not compatible with recognized medical diagnoses. This disorder represents a significant challenge in the field of psychiatry and neurology, bridging the gap between physical symptoms and psychological factors. The symptoms of conversion disorder can be diverse, including paralysis, abnormal movements, gait disorders, numbness, speech issues such as inability to speak or slurred speech, seizures that are not caused by epilepsy, and sensory loss, such as blindness or deafness without a physiological cause. These symptoms are not intentionally produced or feigned. Patients truly experience these disabilities, which can cause significant distress and impairment in social, occupational, or other important areas of functioning. Conversion disorder is thought to result from psychological stress or conflict, manifesting as physical symptoms. The concept dates back to the work of Freud and Breuer in the late 19th century, where they linked the disorder to unresolved psychological conflicts, coining the term conversion to describe the process of psychological distress being converted into physical symptoms. Modern perspectives on conversion disorder encompass a biopsychosocial model, acknowledging the interplay between psychological factors, social context, and biological predisposition in the development of symptoms. Diagnosis of conversion disorder involves a careful assessment to exclude neurological diseases, relying on clinical findings that are suggestive of the disorder, such as symptoms that are precipitated by stressors or conflicts, and the presence of labile indifference, a term used to describe a patient's lack of concern over what would typically be considered distressing symptoms, although this feature is not always present. Neurological examinations and tests might be used to rule out other conditions, ensuring that the symptoms cannot be better explained by another medical or neurological disorder. Treatment for conversion disorder is tailored to the individual and often involves a multidisciplinary approach, including neurology, psychiatry, and physical therapy. Psychotherapy, particularly cognitive behavioral therapy, CBT, is central to treatment, aiming to address the underlying psychological issues and improve coping strategies. Physical rehabilitation may be necessary to regain lost function or manage symptoms. In some cases, medications may be prescribed to manage associated symptoms such as depression or anxiety. The prognosis for conversion disorder varies. While some individuals may experience a rapid resolution of symptoms, especially if treatment is initiated early, others may have symptoms that persist or recur, particularly in the context of ongoing stress or psychological issues. The complexity of conversion disorder necessitates a comprehensive, empathetic approach to treatment, emphasizing the need for greater awareness and understanding of this intersection between mental health and neurological function.